there, my name's Lara Pizzorno. I'm a bone health expert and the author of the book Your Bones. Did you know that many commonly prescribed drugs cause osteoporosis? Since writing the second edition of Your Bones, I've learned a great deal more about the surprising number of prescription and over-the-counter drugs that promote bone loss. Initially, I was inspired by Julie, who wrote to me because although she was only 50, she already had severe osteoporosis. Her doctors told her that her bones were like twigs, and during the 2.5 years before she contacted me, she had suffered fractures of both her hip and her leg. When I wrote back to her in hopes of helping her figure out why her bones had become so brittle at such a young age, she replied that she already knew. I have her letter right here, and I'll read it to you. I have had epilepsy since I was 6 months old. All epilepsy drugs cause a deficiency in calcium and vitamin D. This is a known fact. I should have had regular blood tests throughout my life to monitor this and hopefully prevent the osteoporosis. This, of course, was never done, and even now they don't do it, so I've given up asking for it to be done. They only did a test to check bone density a few years ago. By that time, I already had the condition, and it was just a matter of time before I had the first fracture, a couple of years later. I was very distressed that Julie's doctors did not monitor the effects of these drugs on her bones, especially because her bone loss could have been prevented. Learning of Julie's suffering, her entirely avoidable osteoporosis, impelled me to delve deeply into the research to determine which drugs promote bone loss and what could be done to combat their bone-destructive effects. To my dismay, I discovered that entire classes of other drugs, in addition to those used to control epilepsy, cause bone loss. Drugs like the glucocorticoids, which are also called steroids and are used to treat arthritis and asthma, lupus, multiple sclerosis, and other conditions as well. The aromatase inhibitors, which are used to treat breast and prostate cancer. Acid-blocking drugs like the proton pump inhibitors that are used to manage GERD, which is an acronym for gastroesophageal reflux disease. Even hormonal contraceptives, and that's only a few of the classes of drugs that cause bone loss. So today, I'm sharing what I've found in the research in the hopes that it will help protect you. For each class of drugs that cause bone loss, I've summarized the key information that you need. The Used To section lists the conditions that the drugs are prescribed to manage. The How and Why section explains how and why the drugs cause bone loss. And the Drug Information section has additional information. Where possible in the article below, I've suggested alternative drugs with less harmful effects on bone that you can discuss with your doctor. If you must continue taking one of these harmful drugs, the final section of the article focuses on what you can do to combat their adverse effects on your bones and lessen your risk of developing osteoporosis. I've included the relevant research and studies in case you want to read them for yourself. Remember though, never change your drug regimen without consulting with your doctor. And you can share these studies with your doctor too. I refer to the chemical names of the drugs rather than their brand names because often there are dozens of brand names. You can easily find the brand names by entering the chemical name into Google or Wikipedia. Please continue reading below to see if you are taking any of the drugs that cause bone loss and what you can do about it.
Thanks for watching this video. Don't forget to subscribe so you never miss a video from AlgaeCal. And if you want to see more unique videos on natural bone healthy and delicious recipes, bone building exercises, and so much more, check out some of our videos right here. And we'll see you next time. Thanks for watching.